Today's video is the first in a series of nursing lectures on how to interpret 12-lead EKGs. Chapter 1, EKG Basics, we're going to go over the basic electrical conduction system of the heart. Our course objectives: to recognize the normal rhythm of the heart, normal sinus rhythm, to recognize the 13 most common rhythm disturbances, and to recognize an acute MI on a 12-lead EKG. So let's get started. The normal impulse conduction, the normal pathway that the electricity goes from the heart in order to make the ventricles contract, starts in the SA node, and that is located in the posterior wall of your right atrium. This is going to show you. From there, the signal is going to go to the AV node, into the bundle of His, down the bundle branches, into the Purkinje fibers. So let's look at it one more time. The SA node to the AV node, down the bundle of His, bundle branches, and Purkinje fibers. Notice that when the signal went through the SA node, it generated the P wave. The segment between, from the time of the SA to the AV node, is what you would call the PR interval. That gives the delay from the atrium. So let's go through that. P wave, that is the representation of atrial depolarization. Depolarization just means that's the signal, that the electrical signal that is causing the muscle fibers to contract. It actually occurs a little bit before, but on an EKG or lead 2, which is the normal reference that we look at in an ICU or a telemetry patient, we're monitoring lead 2. And that's because lead 2 gives the best image of the normal conduction pathway of the heart. So there's P wave. And your QRS is going to represent ventricular depolarization. It occurs just immediately before your ventricles start to contract. That corresponds with S1. Your heart sounds, by the way. And your T wave is represented right there, and that just means the ventricles are relaxing. They're getting ready to be depolarized again. So there's the PR interval, atrial depolarization, plus the delay in the AV junction to the bundle of His, and that's what allows time for the atria to contract, before the ventricles contract. So let's go over the pacemakers of the heart. Your SA node is your dominant pacemaker, has a rate of 60 to 100 beats per minute. If for some reason the SA node doesn't fire, we have fail-safes, and your first fail-safe is your AV node. That's your backup pacemaker with an intrinsic rate of 40 to 60 beats a minute. Ventricular cells also can serve as a backup pacemaker, and their rate beats 20 to 45 beats per minute. Okay, let's look at the paper, EKG paper. There we go. Okay. The little boxes and the big boxes are representing time. And this is how we tell how long it takes for when we measure various waveforms. So each big box is 0.2 seconds. Each little box is 0.04 seconds. So horizontally, one small box is 0.04 seconds, and one large box is 0.20 seconds. Vertically, one large box can actually, is 5 millimeters, or you could also consider it to be half of a millivolt. So the EKG paper, you have these dark hash marks. Sometimes the EKG papers are different, and they may have a star or a triangle or a diamond signifying significant timelines on the paper. And it's usually divided into 3-second marks, and so you can use that to come up with a 6-second strip. So every 3 seconds, 15 large boxes is marked by a vertical line. And this helps when calculating the heart rate. Okay, that's the end of chapter 1. I will see you in the next video. Thank you for watching.